I was wondering if you could share a summary of your presentation at AO with us.
Yeah, I'm happy to. Today I talked about a case of a patient who'd been followed in the community for decades with the diagnosis of an inherited retinal disease. She was seen by very smart doctors, and they made the diagnosis because her father had a history of inherited retinal disease as well, and she had chorioretinal scarring that sort of fit. But when she came into my clinic, when I took a look at her and sort of started from scratch, I really felt a strong suspicion that this could be a uveitic condition, and it turned out that she had neurosyphilis that had been untreated for 2 decades.
Wow, that's a very interesting case. And then I know syphilis is an age-old disease, but are there any current changes in our awareness of this disease?
That's a great question. So we've always known about syphilis and we've known how to treat it, but over the last decade or so, we're seeing that the numbers are increasing. And so what I tell patients that no matter what they've heard and how they can contract it, there's always a risk of having syphilis if you're sexually active, and it's always on my list of things to investigate. The other thing we're running into as well is that there's been a penicillin shortage recently over the last year, and just being aware of that and how that can complicate treatment when you work with your ID colleagues.
I see. I was wondering.